This is episode number 55 at the BS Machine. Welcome back, guys. I'm your host, Tommy Kendi, and on this episode today at the BS Machine, we have a guest who we're going to call Dr. A. And the reason we're calling him Dr. A is because he's had to stay anonymous to speak to us on this podcast. Simply for the fact that we're about to have a really candid conversation about what's sort of going on in the world. We're going to discuss all the things around COVID, vaccines, all that type of shit, and we're both quite open and quite candid in this interview. And I've really tried to keep this conversation quite from a mutual perspective, I guess. And I really think it's important that I try to do that as much as I possibly could. Dr. A is a infectious diseases specialist. He's had like 25 years of experience. He's also got even 25 years of experience using vaccines and the history of vaccines, knows all the stuff, all the shit. He's known this from a long period of time. And he also works with doctors in intensive care and nurses. And it was such an awesome chat. And you know what? In this conversation, I tried not to push my view, and you know, I still don't really have a view. I'm just doing what I'm doing. But it was great to have a chat to Dr. A and just really hear what's sort of happening from his perspective and how he sees the world. And I think it's really important to listen to this interview from a place of innocence, beginner's mind. And here is Dr. A and Tommy Kendi having a chat. Here we are. We have Dr. A on the podcast. Welcome, Dr. A. Absolute honor to have you.
Thank you, Tommy. Thanks for inviting me. Do I have to call you Mr. T?
Well, you can call me Mr. T if you want. No, it's an honor to have you on. And I love the way that that we met, because we were at a mutual friend's house the other day, and we just ended up having a chat, and it was really cool. And I was like, Dr. A, you're coming on my bloody podcast. This will be awesome.
Thanks for inviting me, Tommy. Thanks.
Yeah, nice. So look, the reason, to be honest, like on this podcast, I don't usually get people on where we talk about such, I guess, controversial things and whatever. But I just thought, you know what, you're so knowledgeable just by chatting to you, and you're actually a person that knows stuff. So I'm actually really excited to have a chat to you, especially, I mean, you're a PhD in epidemiology. You know, you work with in infectious disease. You're an infectious disease specialist. And you've been working on this stuff for like 25 years, and you know, you've got such a long line of history of working with vaccines, and you know, you also work with doctors at the moment that work in intensive care. But even on that, like in this conversation, it'd be so good if we were able to have our conversation in a way where this conversation is really from a mutual perspective, because you know, especially everyone at the moment, they've got their views and everything. Everyone thinks they're a bloody expert on this whole stuff, and you know what, including myself. So, and there's all these stories that go around. So it'd just be so nice to, I guess, speak to you and get your experience of what you're seeing at the moment, and also maybe get your perspective on the other side of the stick, you know, and see where that is.
Sure.
Yeah. So, I mean, what's your day to day at the moment? What are you sort of getting involved in, and what are you seeing at the moment?
So I work at a couple of major hospitals, and at those hospitals, I'm mainly kind of an advisor to other doctors. So we have other specialists who are actually managing the patient on a day-to-day basis. And largely I am advising those doctors, often very senior doctors, just supervising what they're doing, giving them advice. They'll ring me, we go on ward rounds with them and see all of their patients and discuss them. So I'm very much kind of a senior level, providing advice even to other senior doctors. And it's a mixture of serious infections, people in intensive care with a variety of infections, and you know, lots of COVID at the moment as well. So
lots of COVID,
an increasing numbers. So the two hospitals I'm at between them, there's probably about 50 or so people in ICU, and probably 2 to 3 times that number in the general wards. I don't do that much on the general wards. I actually dealing mainly with the sickest of the sick in the intensive care section.
Yeah, yeah. And just first off, I mean, how does that impact you as a human being, as a person?
Look, I have a very particular role. And I must say, for me, the pandemic has been a pandemic of planning and meetings and all that sort of stuff, because I'm kind of at that sort of level. I think for doctors, there's a limited number of things that we can do for people with COVID. Administration of steroids, some antivirals, which up to now haven't been particularly good, some other immunosuppressives that have a particular role in some patients, and then sometimes giving antibiotics if we think they have a superimposed bacterial infection. But actually, for doctors, for a long time there, we had meetings every day at 8 a.m., 7 days a week for 6 months kind of thing, and really long days and lots of planning and stuff. But actually, this pandemic is hardest on the nursing staff. I mean, the doctors,
Yeah.
by and large, we're not the ones there by the patient bedside 8 or 10 or 12 hours a day wearing the PPE for the full day. I wear PPE sometimes for 3 or 4 hours at a stretch doing a ward round, but that's not like when you're in the patient's room actually doing hard physical work by the bedside. It's the nurses who've largely borne the brunt of this. I've had long hours and sometimes 7 days a week continuously, but not anything, like the nurses
The
do.
nurses, yeah. Yeah.
It's a tremendous strain on them. And there's tremendous rates of burnout. I think people are aware, but in the US, this is terrible. And we're starting to get to that point here where people are just too physically tired, or they've just had enough. In the US, they're having trouble actually getting some of the nursing staff to work, because they've been doing this over there really full on for 15 months now, and they've just had enough.
Just had enough, yeah.
Just had enough now. And, they're kind of in this situation where, by and large in the States, it's a particular demographic that's coming in now. So largely sort of right-wing Republican Trump supporters, and many of them who don't believe in the virus. And so you're kind of in this dichotomy of people who don't believe, relatives who are angry because they don't even believe the diagnosis is correct, because it's something they've sworn it doesn't exist. And then they're trying to do their best for these people, and actually sometimes get abused, I'm hearing from my colleagues in the US. And so it's a really big issue. And I think burnout is already an issue here, and it's going to be a really big issue if this goes on too much longer.
Really big issue. Yeah, yeah. I mean, it must be so tough on, the people at the forefront of this thing actually, seeing what's going on firsthand, it must be, it must be. And so it's so interesting because you mentioned how there is people that don't believe that COVID actually exists, and there's people that believe that there's all these whatever they want to call it, propaganda or conspiracy or whatever. But I mean, in terms of look, everyone has their different views, and everyone has their right to a different view, don't they? And it's like, with what's sort of going on in the world at the moment, do you, as someone that's at the forefront, would you see people that do have different views on vaccines and coronavirus and stuff? Is there any part of you that sees they have anything to stand on at all, or is it just all bullshit?
No. It's not bullshit. Look, it's a complex issue, and in some ways, some aspects of it haven't been as handled as maybe they could have been. It's always easy to say that in retrospect. It's really complex. And look, I've got a lot of friends who are doctors and GPs and whatever in all different areas, and they've all approached it in a slightly different way. But if you look at the data, if you look at why there's some hesitancy around the vaccine, there's not one profile. You've got to really split it up, and everyone is different, and people have to realize that. The number of people who are actually anti-science, anti-vaxxers is very, very minimal. It's about 2 to 3% who are like the vehement anti-vaxxer, take a really strong stance, don't believe in the virus and stuff. That's actually really rare, actually. But we do have lots of people that are hesitant for a whole range, and you can't generalize. So to give you
And
some
what would be
examples.
like? Yeah. I was just going to ask what. Yeah, go for it. Yep.
Yeah, so just to give you some examples, if you look at the data, one of the biggest determinants of whether people will have the vaccine is their own personal past experiences with the medical system, be that with doctors, nurses, hospitals, whatever. And it can even be in children stuff. If people have been treated well and have had really good experiences in the past, they'll by and large have the vaccine. If people have been treated poorly or haven't been listened to in the past, like on completely unrelated issues, they're the ones most likely not to have trust in the system. And it just makes like complete sense. In fact, I've got a really good friend of mine who's a fantastic GP, and she works in a slightly less privileged area, but she got sick of just trying to tell people the science. So when people are hesitant with the vaccine, she doesn't actually go around the science at all. She actually mainly explores what traumas and what their interaction with the healthcare system has been in the past. And it's really interesting, the conversations that she gets out of that. And you know what? She's telling me that, they may not agree to have the vaccine straight away, but like when she spends the time to have those conversations, 90+% of those people at some point shortly afterwards will have the vaccine. And it's about, have you been treated with respect? Have you been listened to? What happened to you? And it can be all sorts of stories, as you can imagine, Tommy. People who were just given short shrift, or they didn't have things explained, or they had their years dismissed, on completely unrelated things. Maybe 20 years ago, they had an admission and they were treated like shit. So it's not surprising that if people don't have that trust in the system, they're not going to trust you now. I can tell you that I treat people with HIV. That's one of my hats. And I have a large, many dozens of people that I treat long-term. And I have got all of them to have the vaccine, bar one so far. And even that last guy rang me on Friday in a very panicked state because that person wasn't going to have that vaccine. And but there were circumstances where they were kind of being forced to have it, possibly. And but that person made the comment to me that actually they really valued just the fact that I hadn't put them into a corner or a position myself, and had listened to them and had always listened to them in the past. And so they haven't decided to have it, but I think that person's going to have it pretty soon. Actually, I think they're going to make the decision, and it's all about the integrity of your own beliefs and all that sort of stuff. And because I've valued that person's beliefs in the past and still valuing it now, I'm not saying they have to do something, but I'm listening to what their concerns are, because it's often not about the science. The science, actually, Tommy, is not very interesting. These vaccines are 1,000 times better than anyone could have ever hoped for. And almost safe to the point of being ridiculously safe. Like it's almost not worth talking about. So it's so much about other things. So there's that thing about how have you been treated? That's probably the biggest independent factor. And kind of on the same thing is distrust of government. So, again, I've got a friend who works mainly with the Polish community. I've got another friend who works with, he speaks Arabic and mainly speaks with people who speak Arabic and stuff. And in those communities, there's a lot of distrust of the vaccine. And, this epidemic often affects people in non-English speaking background communities. And a lot of that stems to, you can't trust the government in the places these people grew up and lived in their lives, and you still can't. And actually that's reflected, Poland has one of the lowest rates in Western Europe. Russia, they can't get their rates above 55% because actually there's a good reason not to trust your government. And actually, if you look at the US, the US government's done lots of bad things in the past. There's lots of reasons not to trust the US government. So,
I know.
So that comes into it as well.
Yeah, absolutely. And what about? I mean, it's interesting with doctors, because I've actually got another friend who's a doctor, and I was talking to her the other day, and she's had the jabs and all that type of stuff, but she actually said that she doesn't really know what's in the vaccine, and she doesn't even know about, she doesn't even know what's in the vaccines, but she just trusts the experts. And so it was so interesting to hear that, because I was like, wow, that's interesting, because even though she's a doctor, she's basically got the same knowledge about the vaccines as I do, which is
Yeah,
like, yeah, she just basically,
that's great.
well, for her, she just trusts the experts. And then, and for me, and I think there's probably a big chunk of people that might be like me who I have no idea about anything. And I'm very just, I don't know, I don't get into the whole anti-vaccine thing or whatever, but for me, it's just like intuitively, I haven't gone to get it yet. I'm just like, you know what? I'm just sort of
Yeah,
sitting around and waiting to see what happens, and
yeah,
and I'm not too vocal about it at all. I don't go
yeah.
yapping on about it to everyone, but it's interesting to hear even from a doctor that she doesn't really know what's in the vaccines either. She's just basically trusting the experts, just like the rest of the community.
Yeah, I think that's fantastic that she's been honest with you. I mean, as
Mm.
doctors, you can know about your little area, but look, medicine these days is so complicated. I know about my area. If I'm treating someone's diabetes, if I'm treating someone's, I don't know, even blood pressure, it's not what I do. I do this really specialized stuff with antibiotics, right? So
Yeah.
I have to take advice, and I don't know the best drug, but if a blood pressure specialist or a diabetes specialist said this is the best drug, I'm just going to trust them on that because I
Yeah.
feel that, oh, okay, they've done the research, they know about it. Just as that's why I go and see their patients because they don't know what antibiotic is necessarily the best one. So that's why I go and give them advice about their patients. And this is really interesting because this is the conversation I had with this guy that rang me last week, who was
Yeah.
hesitant. And I said, look, at the end of the day, none of us are experts in everything at life. So you've got to find people you can trust. And you kind of, at the end of the day, have to give over a little bit of your decision making to someone if you feel that you can trust them. I mean, it's like I'm not going to build my house. If I built my house, it would fall down. So I've got to find like a builder I can trust. If I
Yeah.
want any sort of plumbing done, I'm not going to do it myself. I'm going to get someone, and you've got to kind of trust them. And sometimes you get burnt, and medicine's like
Mm.
that as well. You can get burned. So actually, this doctor that you mentioned who said she didn't know, that's fantastic. I think being honest and
Mm.
saying, I don't have the time in life. It's like GPs are so busy. They're trying to be experts in so many different areas. It's impossible actually to keep up with every single area of medicine, as you can imagine.
Yeah.
So she's being really honest. And actually, I bet you she has a really good uptake of the vaccine from her patients, better than some guy. Because, you can tell people who are bullshitting you, Tommy. So,
Mm.
if
Yeah. Yeah.
I
Yeah.
try and tell you, like, I know exactly each of the 156 components that's in the fibers of vaccine, I will be lying to you. So, and you'll know that straight away just from the tone of my voice and stuff. So,
Yeah.
you should never bullshit someone. But at the end of the day, this is what I said. You got to take expert advice. For this guy, I've always maintained that the vaccine was the right thing for him. And at the end of the day, he just has to choose whether he trusts me. And you know what? He's always trusted me before because we've had frank and open discussions. And so
Mm.
I reckon he's going to trust me on this.
Yeah. Yeah. And so, do you reckon? I mean, is there a risk in taking the vaccine at all?
Absolutely. There's a risk with everything we do in life, Tommy. There's a risk with it. There's no such thing. There's a risk in drinking Coca-Cola. There's a risk in driving down the street. There's a risk with crossing the road. One of the
Yeah.
riskiest places you can live is inside your house. More people die inside their house than outside. So there's risk with everything. Every compound, natural or made up, is dangerous to some people.
Mm.
There are people who are allergic to peanuts. There are people who are allergic to honeybees. There's
Yeah.
all sorts of risks associated with life. It's about weighing up various risks, contrasting risks. And that's the problem, particularly with something like this, because people are unable to fathom really minuscule risks. It's like people are unable to fathom really minuscule benefits as well. So,
Mm.
if you looked at it mathematically, no one would ever play tax lotto. Like your chance of winning is so close to zero. No one would
Yeah.
ever, but millions of people do because they think, oh, someone won, so I must be able to win.
Exactly.
But actually look at the enormous profits that Crown Casino and Tax Lotto and all those people make, like it's telling you something. But
Yeah.
we don't, and there's actually people, there are professors whose whole lives, their whole job is how to communicate risk to people. It's a really interesting
Mm.
issue, actually. The risk with these vaccines would have been interesting if we had a vaccine that caused like 1 in 10,000 people to die. I mean,
Mm.
penicillin causes anaphylaxis, that's severe allergy, in 1 in 10,000 people. If
Yeah.
penicillin was invented today, it would not be passed by any government committee.
Any gum.
It's
And what
and
you know? What?
it just seems okay because we're used to it. But these vaccines, like, we've got what, 8 deaths from 10 million doses in Australia from AstraZeneca. It's like literally less than 1 in a million.
Yeah.
No one could have hoped that we would have a vaccine that safe. And yet the general opinion is, oh, this is a really dangerous vaccine. Like, it's incredibly safer than almost anything else we do in medicine. And for Pfizer, like, we've got data now on over 1 billion people. There's nothing in medicine ever that's been that investigated. And we've got like 30 years of data on mRNA technologies. Like,
Yeah.
it's just so beyond the level of surveillance that we've ever had for anything. I mean, most people are at much more risk from their car driving down to get the vaccine than they are from the vaccine itself. So,
Yeah.
just to put it into some perspective. And the other side of the coin is like, what's the benefit? So that's the risk is really low, but what's the benefit? Again, we would have been happy with a vaccine that was like 70% effective. No
Yeah.
one dreamed that we'd have like 3 or 4 vaccines, all of which are over 90% for severe disease. Like,
And
that's
can you just?
amazing.
Yeah. I mean, it sounds amazing, doesn't it? And so even on that, because there is these, and I'm just talking about the stuff that I hear is that
Yeah.
there's this thing about efficiency, or what do you call it?
Efficacy.
Efficacy. Yep. But then there's this other part which is absolute efficacy, right? And this is So, and I'm just relaying all the stuff that I think a lot of people do talk about and yap on about, which is this thing about 95% efficient, but the absolute efficiency apparently is like 4% of something. And I mean, what does that even mean?
No. So the best data. So efficacy is a term that we use when we talk about clinical trials. So efficacy, and it comes down to the setting in which you do it, the people you give it to. And so it's particular to each trial. So you can't actually directly compare one study with the other. So, the headline data we got was AstraZeneca was like 70% and Pfizer was 95%. And everyone assumed that therefore Pfizer is better. But, efficacy means what percentage of people didn't get the disease, if you like.
Yeah.
But it doesn't take into account if, like, because you've had the vaccine, you have minimal or zero symptoms, but you're being swabbed regularly because you're in a clinical trial and you have a swab that turns up positive. That's a failure. So the fact that you didn't go to hospital, didn't get sick, didn't have any real symptoms, doesn't matter. It's still a failure because your swab was positive. So actually, interestingly, it depends on the study design. If you're swabbing people 3 times a week really rigorously, you're likely to see more failures because you'll pick up a whole bunch of potentially asymptomatics. So actually, the better the study is, the worse the efficacy is. A study that doesn't swab people unless they've got symptoms, for example, actually will show really good efficacy. If you don't, check a temperature, you won't find a fever kind of thing. So you can't compare the studies. And also they're done in different settings, different populations. We know younger people are going to respond better to the vaccine than old people. That's true for every vaccine that's ever been invented.
What does someone like you call young and old? Like, what's the age we're talking?
There's chronological age and there's biological age. So some people are young at 60 and some people are old at 30. So it's kind of like complex, as just kind of makes sense. But generally speaking, with most vaccines, the older you are, the less likely you are to respond to the vaccine. So look, the best thing is to look at real life data. If you look at the real life data, we have fantastic data for whole countries. We have fantastic data for like Israel, for the UK. And if you look at the real life data, all of these vaccines perform fantastically well for hospitalization or severe disease, which are the things that you really care about at the end of the day. So, they're all around the 90, some are heading up towards the 95% mark. That's in all comers. And, if you split it then down into younger people with no comorbidities, no illnesses or anything, you're getting close to 100% actually in those populations. It's quite astonishing because there's very few vaccines that are that good. It's pretty amazing. And actually the differences between the vaccines are minimal actually in real life. AstraZeneca, Pfizer, Moderna, all performing remarkably well, a couple of percentage differences between them. It's astonishing. And, there's questions now about durability. So Pfizer probably is the least durable of the 3, and AstraZeneca's looks fantastic in terms of how long the protection lasts, and Moderna's looking quite good from protection as well. So everyone's trying to work out, will you need a booster dose? If so, when? The people who make AstraZeneca are saying at the moment there's no evidence, even with Delta, that anyone needs a booster. But, let's wait and see what happens over the next few months. And my prediction, and this is just a personal opinion, is that, we're all going to get a booster next year, pretty much, or be offered a booster next year if we want to take that. Yeah.
And would you think that that'll be mandated or not mandated?
No. By next year, the mandate is a really interesting issue and ethical, and we can talk about that. But by next year, we're going to control this thing. We're going to get really high rates of vaccination in this country. I mean, New South Wales has already hit 91% first dose. So,
yes.
We're going to get up to like 95 plus, I reckon, I hope. And similarly, I think Victoria won't be far behind. I reckon we might do worse in some of the other states because they haven't had the problems that we've had. The sociology of this is really interesting. But, hopefully we'll be right up there with countries like Portugal. Portugal, is amazing. They started late and they had a really bad outbreak. Lots of people died and it was really tossed over repeatedly, the health system there. But, they've got essentially 100% of adults vaccinated now. Amazing stuff. And, the total population, because they still can't do kids like us, that means still 85% of the total population has had the vaccine now. So Portugal would be a really interesting one to watch over the next couple of months to see what happens there.
It sounds like a...
Are only, Oh, sorry, go on.
No, I was going to say you're making it sound like like an AFL match or something. It's like Portugal will be an interesting one to watch.
Yeah, no, it is. It's exactly like that. I mean, because actually one of the interesting things about this whole pandemic has been the different responses that people have made. And I think there's been some opportunity to do interesting things and study different approaches. I think the classic one early on was Sweden's approach. I really admired the Swedes and their approach to it because their approach, which was misinterpreted by, idiots like Donald Trump and stuff. But am I allowed to say that? But anyway,
of course you are.
It was really misinterpreted, but I really admired them because what they said was, look, this is a major problem that's going to last with us for years. We're unlikely to have a vaccine under 3 or 4 years. We've got an intelligent, educated population. We'll advise them as best we can, and we will take this more limited approach to the lockdowns compared to our neighbours and stuff. And so I really admired that because it was a thoughtful. And it was, they kept a close eye. They audited what they did. As it turned out, they were wrong, and they said that, but they said it in a way which was again quite scientific. They kept an eye on what was happening, and actually they tightened up their approach as time went by because it was clear that they hadn't done enough work in the areas where it was really important, like nursing homes and vulnerable communities and all that sort of stuff, and immigrant communities and stuff. But it was a really thoughtful exercise for them, unlike a lot of other places where they just let it be a free-for-all because they just didn't give a, what. So I really admire that. And I think with the mandate thing is really interesting because I think there's actually a couple of other approaches that could be taken. The mandates clearly worked in France. I mean, they were stuck in the kind of mid-60s with their vaccination. They brought in the mandate. A month and a half later, they're getting up to 85 plus. It just clearly worked. They had some demos in the street, but the demos in the street are pretty standard for France.
Oh, of course. Well, I mean, yeah. Well, you can understand.
But I think there's other approaches that could be taken. Like I reckon, there's a lot of actual deliberate misinformation spread much more by social media, and that's obviously the limelight at the moment with the congressional hearings in the US and stuff. So I wonder, another approach that could have been taken is actually just to block misinformation, people who are deliberately spreading untruths, not opinions. You can have a different opinion, but it'll be interesting to see if you actually just block or find people who actually say stuff that's just wrong. So just to give you an example, again, one of my patients tried to tell me that he wasn't having the vaccine because he'd heard that Eric Clapton couldn't play anymore because he got side effects from the vaccine and his fingers didn't work. So I kind of thought, I hadn't heard that. So I kind of looked it up afterwards. And actually, apparently he stopped playing because he's had diabetes for 25 years and he can't feel his fingers anymore. So there is this misinformation. and this patient had kind of seen this on and just believed it. So I'm wondering whether, actually just blocking actual
That
lies on
actual lies,
social media
yeah,
might have
yeah.
been a different approach to it. And it'd be interesting to see different countries take different approaches and how that works, what doesn't, and stuff.
Yeah, yeah,
Yeah.
and on that, I mean, because the biggest thing I think at the moment, from what I'm seeing in, I guess, in my community and the community at large, is that as soon as people get forced to do something, they're like, hey, you know what? You don't tell me how to live my life or what to put in my body and stuff like that. So on that, like, regardless of the, I guess, the mandate, what I'm sort of wondering about is that there's two schools of thought which I'm seeing at the moment. One is that, you know what, I'm just going to get the vaccine to help the community and just to move this on, and let's get this done. And then the other side of the coin, which I'm hearing, is like, people are going, do you know what, I'm not putting that shit in my body, and I'm prepared to take the risk of getting COVID, because, you know, they probably think I'm not going to be the type of person that's going to end up in hospital. And I actually did a little bit of research on that too, just to have a look what's going on. And I might be wrong, but I think you even mentioned it when we chatted the other day, that a lot of the people in ICU have got previous conditions like diabetes or high blood pressure, or they're way overweight and whatnot. So is that the case?
Yeah, a lot of them are, but not all of them. So we've certainly got people in the ICU in their 20s. We've got pregnant women in ICU at the moment who are otherwise
Yeah,
perfectly fit and well. Pregnant women are obviously vulnerable.
of
And
course.
look, some of the people in their 20s and 30s are in ICU because they're 105 or 110 kilos. But
Yeah,
do you call that a comorbidity or not? Like, they're otherwise well. So there's a lot of people, let me tell you, who, I can't remember the figures for Australia now, but if you look at
yeah.
obesity rates in Australia, I think it's like 60%, isn't it, Tommy? Sorry, I'm not an expert in that area, but
Crazy.
I
Yeah,
think
yeah,
it's like
yeah.
really crazily high.
Yeah,
So yeah, sure. There's not, and then you get the odd death in someone who's perfectly well. Like, there was that very sad case in Sydney reported of the young soccer player in his 20s who's perfectly well, who
well,
dies
yeah.
probably of myocarditis, heart
Mm.
inflammation, which is something that COVID does, or a clot possibly.
Yeah,
So you
yeah,
do get the odd case in a young person. But yeah, no, it's very true that a lot of these people are vulnerable, and a lot of them are also from non-English speaking backgrounds, because they're the communities that are always affected by things in our community. If you're rich and wealthy and live in the inner city, you're kind of privileged, and for those of us lucky enough to live in that circumstance, we need to remember that we are privileged.
mm.
And you actually have to actively remind yourself that not everyone is connected
Is
in the same way and has that choice. I think coming back to the mandate, look, it's always sticks and carrots, isn't it? And you got to have you got to get a balance with these. We've always had mandates. I mean, if you go to a yellow fever country, you can't get back into Australia if you've not had the yellow fever vaccine. That's
yeah,
been a law for a long time. We've had yellow fever outbreaks in Australia. That's always a law. That's why when you come back in the country, they ask you, have you been to South America or Africa in the last 6 days? So
yeah,
there's mandates have always been with us. They're not like new. There was mandates for TB. There were mandates for polio. It's just some of those have been kind of dropped because of vaccination, we don't see those diseases anymore. So here, but the Netherlands had a polio outbreak within the last 20 years because vaccination rates dropped so low, and someone came back from a third world country with it and reintroduced it. So, we have had mandates for a long time. I think you need mandates in some areas. I think for me, Tommy, in areas where you could cause significant harm, mandates are
yeah.
reasonable. If you're looking after, the elderly in aged care facility, I think that's a no-brainer. Like,
Mm. Oh,
you shouldn't be working there if you're going to cause harm. And same in hospitals, and probably for teachers and stuff.
yeah.
But where do you draw the line? Yeah, absolutely. Like, the
Well,
government, I think, is in a very hard position of trying to decide where you draw the line.
mm.
Uh, but I think it's about harm to others for mandates, and then you've got to offer incentives. So it's got to be incentives for other people. So I don't think you can mandate it for everyone in the community, clearly, and the government hasn't tried to do that. They've always said they wouldn't do that, but
Well, they
I
have,
think
haven't
some
they?
incentives.
Yeah, I'm sure that I mean, pretty much what they put out. The last thing that I saw that they put out it was pretty much like a blanket of, like, most people have to mandated to get it.
Authorized, well, my understanding is authorized workers have to, essential workers, authorized workers.
Essential. Yeah.
Some industries have said it. So obviously, healthcare, aged care, disability sector.
Yeah.
Priests, if you're officiating in circumstances where you can't distance from people, that sort of
Yeah.
stuff. But a lot of private industries have decided to make up their own rules. But no,
Own
no,
rules,
no, no.
yeah.
It's not mandated across the board, and the government would never do that. I don't think, and I don't think that's necessarily the right way to go. Though it'd be interesting to see different countries take different approaches and how
Yeah,
that played out.
absolutely. Yeah.
Some
And
countries
then,
have been very good with incentives of having lotteries, and if you have it, you get entered in a lottery. And there was a proposal for that here. I thought that was a great idea. $1 million a week, can you win it? I bet you all Australians like to bet, and so that would have been a great thing in Australia, I reckon.
that is hilarious. I love it.
Yeah, yeah,
And so, on this, like, let's say where we stand now and where this is heading over the next 6 to 12 months, like, you know, I my question is twofold. One, if you're a totally healthy person, between the ages of 20 and, no, I don't know, 20 and 60, and you're totally healthy, and there's absolutely nothing wrong with you. You eat healthy, you exercise, you're rocking it. You've done your tests, and everything's rocking in your body. Does it matter whether you get the vaccine or not?
yes, it does. Because one of the things people don't realize, is up to now, we've controlled this through lockdowns, through mask wearing, all that sort of stuff. But because of the fantastic effectiveness of the vaccine, even the people who are pro-lockdown, pro-mask wearing, once everyone's had the chance to see vaccines, and I hear this conversation all the time, is, after that, everyone thinks we should just relax. Okay? So that means the virus is not going anywhere. Remember, we've not controlled this in the world. As soon as we open up, the virus is just going to go through the community. All of us are going to get exposed to the virus. We're all going to get it. And even in that group, sure, the risk might be low in the healthiest people, but there's still maybe 1 in 1,000 chance of dying. Tommy, there's not much that you would do in your life that has a 1 in 1,000 chance. If your work involved a 1 in 1,000 chance of dying, your union would be up in outrage. We take many more precautions at much lower risk than that in the workplace. In construction, we have all these safety things. We have, hazard reduction. We have, every workplace. There's no workplace in the world that would accept a 1 in 1,000 risk of dying at work. Now, and it might be rare, but myocarditis, clots, all of that. But you're right, the risk is low for most of those people. And maybe you say, well, I like skydiving, so maybe my risk of skydiving is 1 in 1,000 over the next 2 years. So, it's equivalent to the risk of going skydiving or whatever. I don't know the risk of skydiving. I'm just giving an example of something that's risky.
You're probably around.
But it's also the other side that you just referred to. It's also about transmission and spreading to other vulnerable people. This ain't going anywhere. So the only things that in pandemics are a really good vaccine or a really good medicine against it. And we still don't have a really good medicine, though you've probably heard some interesting news on a couple of new drugs.
The antiviral, that red pill. How's that looking?
Yeah.
I mean, what's the deal with that?
Yeah, look, it's all kind of preliminary stuff. So we haven't seen the real data, so we need to see the real data. And there's actually there are 3 different companies that have a similar pill, all of which look very promising. So that could be a game changer as well. And that could.
And so is that literally like a Panadol? Like you get COVID and you have that, and it basically makes it go away.
Well, it's not quite like Panadol, because Panadol only treats symptoms.
Well, as in,
this is actually a specific antiviral. So it's like an antibiotic for an infection. It dramatically reduces your risk. The company is telling us it's 85% reduction in the risk if you get COVID, if you go on this very early, of going to hospital or getting severely ill or going to ICU. And there's 2 other companies that have similar drugs that we think might also show considerable promise. That could be a game changer. HIV is the classic one. HIV, which is our last major pandemic, and still ongoing, No one's ever been able to make a vaccine because the virus is so clever at inserting itself right into your genetic information that it can't be got at with vaccines, antibodies. But we have controlled that by and large with medicine that's highly, highly, highly effective. So that's the other way out of a pandemic. But, because we've never had a vaccine, HIV is still a major problem. And I still see young guys getting HIV for the first time now. So this is the problem when you don't have a vaccine. But the tablets have been fantastic, and we can take the tablets as prevention, which is also fantastic. So these new antivirals may be a game changer for us. They're quite expensive. A course of them could well be, up to $1,000 or so. So it's not cheap. Whereas a vaccine is, $30 or less, depending on who are buying it. But it still could be a game changer for us. We've also got some other new technologies now. We've got this new monoclonal antibody we've just started rolling out. So again, if you are not vaccinated, or if you're immunosuppressed where the vaccine may not be very effective, if you come in very early, within the first 5 days of your symptoms, you can have this intravenous infusion of this artificial antibody against COVID, and that similarly produces a major reduction in your risk of going to hospital or going to ICU.
And that's already available?
It's available. It's been rolled out in Sydney. It's been rolled out in Melbourne. It'll be rolled. I don't know about the situation in other states, but it's certainly available in Sydney and Melbourne at the moment. And that's amazing. But what's really interesting about that one is, you've got all these largely Republican voting anti-vax people in the US who are worried about big pharma making lots of money. So they reject a $30 vaccine. But when they get COVID, they are demanding this antibody, which, in the States can be $5,000, $10,000, highly artificial antibody. And they haven't won the toxicity of the vaccine, but they're very happy once they get sick to have the completely artificial monoclonal antibody put in veins. In fact, they're demanding their right to have it. So quite an interesting kind of hypocrisy emerging there. And that's the treatment. That's the sort of treatment, not exactly the same, but it's similar treatment that obviously President Trump got. When he got COVID, he was given a product by a company called Regeneron, which is an artificial antibody against COVID, which is why presumably why he didn't get too sick.
Yeah. So interesting. It's such an interesting dynamic, and it is. But then end of the world, like I think what everyone wants is just everything to go back to normal, and for us just to go be able to live and travel and enjoy life again. And I actually think that one of the hardest things as we start to open up and come out of this whole debacle will be people actually getting back into life and getting back into, because just like everything else, this will be a whole thing that will just pass us by, just like everything else does. The old saying, "This too shall pass," and I think this will too. But it's going to be it'll be this dynamic where right now it's this whole thing about I am or I'm not, what's in the vaccine, and just get the vaccine to protect the community, and then there's so many different avenues you can go down, there's so many different things you can look for, but really it's just would you agree that that every person should have the ability to trust their own guidance or their own gut or their own intuition?
Absolutely. In medicine, we can't, absolutely dictate. If someone is of sound mind, if someone wants to kill themselves or not have a life-saving treatment, we can't stop them doing that, even though it doesn't seem rational to us. On the other hand, the only path out of this as a community is vaccine or a really highly available drug, active drug that's readily available to everyone. And we don't have the latter. It's the only clear path to normality is for as many people to get vaccinated as possible.
And so how long do you reckon that those antiviral drugs and whatever that little red pill how long till they come out, do you reckon?
Oh, look, that's some time away. I don't know. It's only the company telling us, and they make announcements to the stock exchange before they do to the medical community these days. And it'll be expensive. And if you're suggesting that everyone gets COVID, get the pills at $1,000 a shot instead of the vaccine at $30 a shot, like we'll be broke as a country, and
Yeah.
it's just not tenable to go down that path. It will be an alternative because some people don't respond to the vaccine. Some people can't have it for various reasons. So the number of people who can't have it is exceedingly small. So it's nice to have that. And sometimes you need a combination of things. New variants might emerge. So these will be frontline if we get new variants, as long as the drug's still working. And so we need a combination of things. But really the only path out of this if we want to talk about weeks of getting out of this, then it's the vaccine, which is available now. It's available, it's safe, it's relatively cheap. We got it ready to go. It's kind of like the way out. And everyone just wants to get back to normal. And we have this now clear path. We should be so thankful that we live in a country like Australia where we have this available to us. Most of the world does not have this available. And, Tommy, do you know how many people have died of COVID in the world so far?
I'd assume it'd be up in the millions.
So current best estimate is around 15 million people have already died of COVID. The official numbers are somewhat below that, but you can't trust the numbers from, places like Russia and most of Africa and South America, etc., where the numbers are gross. But if you just look at the excess deaths, the best estimate from The Economist is intelligence unit. It's around 15 million, possibly up to 18 million people have died, mostly in the third world. And they would be begging to have this vaccine if they could, and they don't have it and we do. And it's kind of, again, slightly Western arrogance to kind of have it and not use it, and also to be sending as much of the vaccine. Because at the end of the day, we are vulnerable because of the ongoing viral transmission in Africa, South America, much of Asia. If we don't control it in the world, just new variants are coming up, some of which the vaccine may not even work against anymore. And so we could be back at square one, actually.
Yeah. Well, that's the thing, isn't it? So ideally, like there'll be something like this antiviral drug or whatever that will come out where, because the vaccines people are getting now, they may not work if there's new variants.
That's a possibility, but actually the current vaccines seem to be remarkably good still. So we're in a very fortunate situation. So the more you control the virus, the less ability it has to vary. So if we control it, we won't see variants. This is true in HIV. If we can control the virus, people don't get resistance to their drugs because you just control it. It's only when you let it go. So the pity is that we're not controlling it in the rest of the world. And that's something that, people should be up in arms about. We should be spending billions of dollars. There was an estimate again from The Economist that we could vaccinate the entire world for a relatively small amount of money. And the return in investment was something like 15,000% or something extraordinary. And yet we're not doing it. But, it raises really interesting things, this pandemic. I think you mentioned that before, that, we've shown that we can do some things and act collectively as a society because we want our society to be better. And yet there's some really interesting sociological things about this pandemic that are still to play out. And we've seen it all before with past pandemics. People after the pandemic seem to be under control. They seem to reevaluate their lives to a large extent. This has happened in the past. Often there are periods of great creativity. After pandemics, people often leave their job or change their job or change their life course after a pandemic in the following year. There's a prediction that by about March or April next year, we'll see mass resignations in jobs as people reevaluate what they want to do with their lives. As we go back to normal, people will say, well, actually, having been through that, I'm not going to waste my time in a meaningless job. I'm going to go for what I really want to do or in life and all that sort of stuff. So I think it'd be really interesting to see how that all plans out. But the sooner we can bring this under control with widespread vaccination, the sooner people can get on with their lives.
Yeah. And what about, just out of interest, like on that, well, I guess we've been talking about the vaccine quite a bit, but if you had a choice between taking the vaccine or an antiviral drug or something else, what would be your choice?
I've had the vaccine.
Of course you have. Yeah.
There's no question the vaccine. I mean, we can prevent all of that for $30. Like, why would we spend $1,000 on a medicine that's less effective?
Yeah, but if money was no issue.
Money's always an issue, Tommy. Money's always an issue. And also safety. Drugs have side effects. Like the vaccine, we're talking about 1 in a million people die from, or less than 1 in a million die from AstraZeneca. Like, there's no drug I use in medicine is that free of side effects. All drugs, your Panadol that you take on a daily basis has more side effects than that. So, many people die of Panadol overdoses and stuff every year in Australia. So, extraordinarily safe, extraordinarily easy to get, 2 little injections over a short period of time. It's kind of a no-brainer. Why would you want to take the risk? And also there's this transmission issue, you may not feel that you're personally at great risk, but you are at some risk, but it may not be great. But, the vaccines also clearly diminish transmissibility, because if you don't get sick, you're less likely to cover it. Now, it's interesting because these vaccines are superbly effective at stopping you get severely ill. They are only somewhat effective at stopping you passing on the virus, because they reduce the how can I explain it simply? Let's put in sort of simple terms. If you like, they provide immunity within your system, within your blood, if you like, against the virus. So the other virus can get onto your body surfaces. It doesn't like enter your system, if you like. That's kind of putting it really simplistically. So you don't get particularly sick. You may have a bit of a sniffle, you may feel a bit run down, but most people who've had the vaccine, even if they get the virus, don't get particularly sick with it. But they're not as good, unfortunately, against what we call mucosal transmissibility of the virus. So your surfaces can still have the virus growing on them. So up your nose, in your mouth, etc. And so you can, even though you don't get sick, still have it to some extent and pass it on. So unfortunately, although the vaccines are almost 100% against severe illness in most people, they're nowhere near as good as transmissibility. But if enough people have it, it still makes a massive difference to transmissibility. So it is about something we do collectively as a community for other people, because we may not get sick, and even the people around us may not get sick. But if we give it to someone and then that person gives it to their mum or dad or grandparents, that person will die, even if they're vaccinated. Because we know, like in the elderly or people who've had a kidney transplant, or my HIV guys who might have a low immune system, vaccine's just not going to be as good. I mean, no vaccine is as good. So it's about working collectively. And I think this is the other really interesting thing. We've shown actually as a nation, collectively, we can vaccinate. Sydney's 91%. Melbourne's going to reach that and probably exceed it. We can collectively do something. We can collectively shut down our society to prevent harm to disadvantaged people, to migrant communities, to the elderly, etc. I think there's a big question. A lot of the price has been paid by young people under 40 for that, who've disproportionately suffered because of lockdown. And yet, we don't seem to be having action on, climate change, housing affordability, all these other issues. So I think there's some really interesting things. In fact, a lot of the arguments against action on climate change have just been blown out of the water by the pandemic. We can act collectively if we want to. It's just that we choose not to. We've chosen to because older rich people are more at risk in some cases from the virus. But if we can do it for the pandemic, why can't we do it for climate change? And yet, look, from a personal thing, we've got a prime minister apparently is looking for reasons not to go to Glasgow or to the G20 summit. I think young people should be on the streets about that sort of stuff. I mean, I think we need to get this pandemic over. We've got the technology, just let's do it. But I think there's a real reckoning, particularly for young people who've been selectively disadvantaged, I think, by the pandemic. Some older people have. I'm not saying they haven't, but overall, I think the downside with the pandemic was disproportionate on young people, and the benefits were somewhat disproportionately in older people. So I think there's now a reckoning where issues that are important to young people, like climate change, housing affordability, etc., work security and stuff, really, really have to be addressed, because we've shown we can do it collectively, and we need to do it collectively for some of these other issues, in my view.
Absolutely. No, I 100% agree with you on that for sure. And look, what's funny? Just as you're talking, I was just thinking, and in my head, I'm going, "Fuck, do I say this?" Because it might come across quite arrogant, or it might come across as as like I'm
Say it,
being.
Tommy. Say it. I know you're not arrogant. Go on.
No, because I'm not, and my my listeners know that I'm not as well. I just speak my mind absolutely. But one of the things that comes to mind around the vaccine, going back to that, is and I've heard a few people say this as well, who in my community, they are quite healthy and they look after themselves and whatever, and some of them do say, and I question this as well, is like, you know what, like I spend time, I spend money, and I make sure that my body's healthy, and I exercise, I eat quite well, my mental health is on point, I meditate, do yoga, all that type of stuff. So then why do I have to put something in my body that I don't want to save people that are that haven't been looking after their health, and they haven't been proactively making sure that they eat well and that they meditate and they do yoga. And this is what I'm saying, where it might sound totally arrogant or dumb or whatever, or insufficient or whatever, but it's a genuine question. It's like, what people that
Sure.
like why would they have to take a massive risk, which they think is a risk of putting all these poisons into their body, to save people that have not been looking after themselves and eating fucking McDonald's for the last 20 years?
Yeah, sure. Look, I mean, it's great that you expressed that. Look, first thing to say, though, it's not a poison.
Yeah. Well, no, I'm saying that they're, sorry, my bad. It's that's not. I'm saying that would be their perspective.
Yeah.
Of,
Okay. They're a bit
yeah.
fearful of it. Yeah, it's
Yes.
not a poison. It's been tested. It's a little bit of a protein, and of a virus, and we're exposed to viruses every day of our lives. Like, that's normal. That's how life is. We would not be human without the viruses that we've met in the past. A lot of our genetic information is viral in origin. It's just that most viruses are harmful, but the occasional one that's come across in evolution has been helpful to us. So this is normal. And to be exposed to viral proteins is normal. It's actually what happens. That, a lot of the common cold viruses are coronaviruses. They probably were highly pathogenic in the past, but they wiped out all the people that weren't immune to it, and only the people left walking around are people who are relatively immune to it. And that's why they're just now, some of those coronaviruses are just common cold viruses now. And this virus in 500 years may turn into a common cold virus, actually.
Yeah.
So it's the same thing. So it's not a poison, and it's highly tested, and it's just reflecting what would happen normally anyway, is that you would get expressed to some viral protein. So that would enter your system anyway. And if you get COVID, those proteins are going to enter your system anyway. So you're going to be exposed whether you like it or not. It's just whether you do it in a controlled manner or an uncontrolled manner. But why do something for other people inside? That's a great question, Tommy. And if everyone was privileged and had access to gyms and had money and never had illnesses and never had a bad upbringing, that would be probably a reasonable thing. But most people who are disadvantaged don't have a choice about it. Most people who are disadvantaged, they come from backgrounds that don't educate them. I mean, I'm lucky like you. I go to a gym regularly. I practice yoga and I love doing all of those things. But Tommy, you and I are privileged. You and I live in a fantastic area. We come from privilege. We're able to enjoy that. A lot of people aren't. And it's not necessarily their fault. A lot of people who are overweight, there's a big genetic. We shouldn't fat shame people. A lot of it is genetic. Two people can eat the same food and one person will end up 130 kilos and the other person will stay slim. I'm lucky enough to be slim. I've always been active and stuff. And I'd like to say that was because of all my hard work and going to the gym and stuff. But it actually probably partly just genetic and partly just my personalities. I like going to the gym,
You do look great for your age, Dr. A.
Thank you, Tommy. So do you.
Thanks, brother.
But we got to remember that a lot of people come from difficult backgrounds, non-English speaking backgrounds. They don't have the same access to information that we do. Health education wasn't great in the past. Look, some people do dig their own nest, but a lot of people don't, Tommy. A lot of it's genetic and stuff that we can't control, and we shouldn't fat shame, and we shouldn't pick on people.
Of course, I wasn't fat shaming.
Like in the US, like a lot of people who are homeless and stuff, actually, like, I can't remember the figure, don't quote me on the figure, but I think it's like 80% of people who are homeless actually have had some major, major illness in their life. And that was like because of the lack of like Medicare and stuff there, they end up on the streets because they can't afford their medical bills. And people who are even stable suddenly get like, a kid gets kidney disease or something, and suddenly they just can't afford to pay all the bills and they're homeless. Like, you know, we should
So,
be looking after those people,
oh,
because
yeah.
it's sometimes not under their control. And a lot of it, we shouldn't be conspiracy theorists, but a lot of it, there's a lot of sugar and stuff that's sold commercially, and there's a lot of advertising. That's a whole different discussion about the
It
way our
is.
society works and where people make money and all that sort of stuff.
Yeah, yeah, yeah. Oh man, I feel like we could go on for so much longer, but I reckon we definitely got the main points out of this convo, Doctor Ray, and it's such an honor to get you on, and thank you so much for speaking so candidly about everything. It's I'm sure the listeners, well, they will get so much out of this conversation. I think there's some definite gold in there, and just really wanted to honor you and the work that you're doing, and it's so powerful. And one of the things I definitely noticed about you is that you're just so passionate about the work you do, and I absolutely love that, and it really comes through in the way you speak.
Thank you, Tommy. That's lovely for you to say that, and I do feel passionate about this because I know this is the way out. I give this vaccine to all of my patients. I see the benefits of it. I've worked with vaccines over many years, for people traveling even to smallpox areas and in the very distant past, and yellow fever more recently, and over 30 years of medical practice. And it's fantastic that we've got this, and so we should take it, by both hands and celebrate the fact that we have a path out of this, and we should be sharing that with the rest of the world. So a bit of, if the listeners could also get their MPs and stuff to also advocate for increasing foreign aid and saving lives, not just here, but actually in Africa, Asia, South America, etc. It would be a fantastic thing. And I hope people get politically active. I think there are lots of lessons out of this. I hope, we live to see some real change in other areas like climate change, etc. And I hope young people are motivated to get really politically active about this. I know a lot of
Mm,
people are. I'm lucky in my job to actually deal with lots of really interesting young people. It keeps me passionate and young to see their enthusiasm for this. So I think we're going
yeah.
to see some really interesting times in the next few years.
Love it, Doctor A. Love it, love it. Well, I guess I'll see you on the other side of the pandemic.
Yeah.
So there you have it, guys. My chat with Doctor A. So that was a cool chat. I mean, I definitely got a lot out of that, and it definitely provoked a number of things within myself. But at the same point, I mean, talking to guys like that, they're so passionate. It's what they've been doing their whole life, and I think it's so cool that he came on the podcast and was able to be so frank and so open and honest. And you know what? One of the things that I definitely got out of talking to him and talking to a number of other people that aren't on this podcast or that haven't come on this podcast is that, I mean, look, everyone has their own view, and everyone's going to really, you know, get evidence for having their own view and getting evidence and finding evidence to protect their view. But I think what's really important, and I think what I really got out of chatting with Doctor A is that he knows his shit. So whatever's good for him and his community is good for him and his community. And for you, maybe it shifted your way of thinking, or maybe it just cemented something for you that you already knew. But I still think that with my view of the world and my perspective, I think it's super important that we all do things and we all make choices in our life that feel good for us, and that that naturally and organically feel like it's the right way forward. Don't fucking listen to anyone else, whether it's a friend or whatever. I mean, if you want to do your research and make your choices based on that. But I think, speaking to Dr. A, he definitely knows his shit, and very, very powerful, very honourable character. And I was super blessed to have him on the show. So thank you so much for coming on, Dr. A. And I will see you guys on the next episode of the BS Machine. Fucking love your guts. Yeah.